many times have you heard middle-aged women say, "It's hot in here"? I know I've said it lots of times in public and in private. Some jokingly call those power surges or temperature tantrums or hot flashes. But what are they really describing? It's known as the medical name vasomotor symptoms, which is associated with menopause. By 2025, an estimated 21 million women in the United States will have VMS. That's a lot of heat, but today we will hear more about the burdensome condition that impacts so many women and a new resource where you can go to learn more. Joining me now is Dr. Mary Jane Minkin, clinical professor in the Department of Obstetrics, Gynecology and Reproductive Sciences at the Yale University School of Medicine. Thank you so much for joining me today, Doctor.
McCabe, thank you so much for asking me to be with you. It's great to be here.
My pleasure. Now, first tell us, are hot flashes something that most women experience during the menopausal transition?
The answer is unfortunately yes, that about 80% of us, as we go through the menopausal transition, will experience hot flashes. And of course, the fancy word for that is vasomotor symptoms, which is the medicalese term. And not only will 80% of us get them, but they go on for a while. The average median duration is 7.4 years. And unfortunately, a number of women will have these for 10 years or more. So this can be a real problem. A hot flash can last for a minute, it can last 5 minutes. But when you talk to a woman experiencing it, she may say it's lasting for hours. That's how much it feels like to her to be uncomfortable.
Yes, indeed. And I can certainly attest to that myself. Now, we know some of the things in terms of how or what women can experience when hot flashes occur and how people can react to, women while they're experiencing those hot flashes. Tell us what are some of the things in depth that is happening to the body when those hot flashes occur?
Well, there's a lot of really important physiology that's going on, because a lot of people say to women, oh, it's all in your head. I'm sure you've heard that too. But the key thing is that what we can say to them, and I say to my patients is, yeah, it is in your head. It's happening right here in the hypothalamus, which is at the base of our brains where a lot of these changes are going on. And the hypothalamus is sort of your internal thermostat that sets the body's temperature. And as the changes that are happening to our bodies during menopause, it sets off an imbalance in the hypothalamus, triggering heat, and then the women just have to dissipate that heat. It has to go out. So what happens is the women will get hot, and then they'll sweat, and then they'll lose heat, and they'll get cold. And it's pretty uncomfortable for a lot of people dealing with this. So it can be really problematic for women.
Yes, it's very uncomfortable indeed. And then they come out of nowhere, don't they? So, you have that situation going on as well. Now, let's talk about night sweats, which is another thing that can be burdensome for women. Do these only happen at night or do they happen in the day as well?
Well, during the day, we're getting the hot flashes, and we call them that. And what happens is when we get them at night, people tend to refer to them as night sweats. And what happens is very uncomfortable because the women will wake up sweating. She'll be hot, she'll lose heat, and then she'll get cold. And then maybe if she's lucky, she'll fall back to sleep for a while, and then she may get up with it again. And what happens is when their sleep is disrupted is, how that continues to the next day. You feel tired, you feel irritable, and your brain's not working real well. And this is important. This is really a problem for a lot of women. And that's part of the reason I'm really excited to be here, partnering with the folks at Astellas to educate women about these hot flashes and educate them that there are things that we can do to make women better. So it's really important, I think, for women to understand this.
Absolutely. Now, tell us some more about your partnership and what women can do on a regular basis to help manage these hot flashes or at least be able to withstand them when they come on.
Sure. And there are certain things that are really helpful. For example, at night, getting back to the night sweats, that keeping the room cool at night tends to help women. Of course, I don't want them freezing out their partner, so I tell everybody to get an electric blanket with dual controls, and that actually does help. And I also have women keeping like a dry nightgown next to them in the bed, so when they wake up sweaty and hot and miserable, that they can take off their sweaty nightgown, get back into something dry, hopefully let them cool down and get back to sleep, so we disrupt their sleep as minimally as possible. During the day, day, it's getting a little cooler outside. So we may be wearing sweaters, and I encourage people to wear a shell underneath so that when they slip off their sweater because they're really hot, they can be decent underneath, when they do that. So those are simple things that one can do. And there are also some lifestyle changes which many women don't know about. For example, things that I call in my good and good for you category, that indeed smoking women end up with more hot flashes than women who don't smoke. So if we can work on smoking cessation, that can be really helpful to the women. And also weight loss. If somebody's significantly overweight, if we can help her lose weight, that'll help her with her hot flashes too, and it's good for her. So it's the good and good for you category. And there are some many other things that can be done to really help women deal with these.
Yes, thank you for sharing those tips. And I'm glad you brought that up about the smoking cessation, because I know that my mother, when she was going through menopause, when she was alive, she had tons and tons of hot flashes, like all the time. And I just thought that when I got that age that I would, have them all the time, but I don't have them nowhere near as often. And you just answered why. She was a smoker. I'm not. So
That may be
yes.
part of the issue, and good for you. And hey, if we can encourage one woman and help her to stop smoking, I think we've done a good deed for the day here.
Exactly. So thank you for sharing that. I bet a lot of women did not know that. And what else would you like for women to take away from our discussion today? I know a lot of women who may not be totally menopausal, but premenopausal.
Sure.
What was some things you'd like for them to take away from this today?
Well, a couple things be aware that people can get the hot flashes before they finish having periods. That's something. So when they shouldn't think they're crazy if they're getting hot and say, "But I'm still getting my period." Well, you may still be getting hot flashes, and no, that's
Right.
true. And indeed, as we talked about, they can go on for a while. And there's a really nice new source out there for women that I'd like to tell them about. So you can learn a lot more. A website called What's VMS. Those are those vasomotor symptoms.com. So it's what'svms.com, and women can learn a lot from that. And also help them maybe to open up the conversation with their friends, because a lot of their friends are experiencing it, but they may not be talking about it. And also encourage women to talk to their healthcare providers, because there are a lot of things out there that we can help women with, and we don't want them ashamed to be talking about these things, because there's a lot of help available. So go to what'svms.com and learn some of these things to help you.
Thank you for that. And also, thank you for mentioning about opening that conversation with your healthcare provider and with friends and family members of women of similar age that may be going through the same thing. That's
Right.
definitely important. Yes, we have to be our own advocates as well as advocate for each other.
Absolutely, McCabe, and thank you for pointing that out, because indeed, you're not afraid of talking about symptoms, and I think all of us should be out there saying, "Hey, we're all in this together. Let's get ourselves better."
Yes, like I could tell you, I attended a jazz concert a couple of years back, and didn't know my cousin was going to be there. She's 1 year younger than me, and we were like, "Hi, hi." We hadn't seen each other in a while, and the very next thing came out of her mouth was, "Are you experiencing hot flashes, girl?" I say, "Girl, yes."
Yeah, and you're in
But
good company, but don't suffer. There are things we can do.
exactly, yes, we gotta support each other and help each other through it. So, again, want to let everyone
Sure.
know that website is whatsvms.com. That's WHATS. VMS.com. Definitely go there for more information on everything we discussed today, as well as some tips that can help you get through this stage of hot flashes, night sweats, and menopause. I want to thank you so much again for joining me today, Dr. Minkin. It's been a pleasure. Thank you for all of your helpful information today.
Well, thank you, McCabe. It's been a pleasure here, and thank you so much.